my name is Brittany Kennedy Lopez, and I will be presenting on our first journal club today on a study regarding the efficacy and safety of ashwagandha root extract on cognitive functions in healthy stressed adults. So, the role of stress plays a significant role in an individual's overall well being, specifically their mental health. According to the researchers, stress can adversely affect cognition, sleep hygiene, and our physical well being. Cortisol levels, a stress hormone, is released by the adrenal glands in response to the activation of the HPA axis. A chronic high level of cortisol is linked to increased stress, anxiety, and cognitive impairment. So, the researchers of this study really wanted to understand the complementary and alternative medicines used in the roots of an ancient practice called Ayurveda. This is an ancient Indian traditional medicine comprising a balance of harmony between the body, mind, and spirits. Ashwagandha has been used in this practice for an extremely long time, as this herb has anti-stress, antioxidant, anti-inflammatory, anti-arthritic, and anti-tumor properties. Recent evidence has shown that ashwagandha root extract can help reduce the stress and improve cognitive functioning. So the purpose of the study was to assess the efficacy and the sustained release formulation of ashwagandha root extract of 300 milligrams on cognitive functions, stress levels, sleep quality, and our overall quality of life in individuals experiencing stress. The focus area of the study was to focus on the memory, attention, and executive functioning, whereas the secondary objective was to assess the effect of ashwagandha on stress and well-being through psychological measures, for example, the perceived stress scale, and biological measures such as serum cortisol levels. The safety objective and endpoints included assessing for safety and tolerability of ashwagandha extract of the 300 milligrams, as well as monitoring for adverse events through vital parameters, including lab values such as their CBC, ALT, AST, and our creatinine levels. The subject criteria included the inclusion of healthy adults 20 through 55 with that BMI of 18 to 29 kilograms per meter squared, and a PSS score of 14 through 24, which is a stress scale, and I will get into that in a couple more slides from now. The exclusion included pregnant and lactating women, women planning to become pregnant, postmenopausal women, a education level below 8th grade or the inability to read, severe comorbidities or systemic diseases, substance abusers, individuals who've already been in a clinical study within the last 30 days, and lastly, individuals that are hypersensitive to specific ingredients. The overview of the study included the assessments of data being collected on subject history and baseline PSS score, and a preliminary laboratory tests were completed. That all occurred within that first visit. The second visit included subjects being randomized into the ashwagandha and the placebo-controlled groups. An independent statistician generated the sequencing, and baseline data was collected including the CANTAB, the OHQ, the PSQI, serum cortisol, and the BDNF, and that was all included in that second study, and again, I will get into more specifically what all that means in a second. The third visit data was collected again, and then fourth visit was the final assessments of efficacy and safety endpoints. So what are all these study assessments? So the CANTAB is a Cambridge neuropsychological test automated battery, which includes testing on working memory, learning, and executive functioning. The PSS-10 is a self-reported questionnaire evaluating situations that can result in stress. The serum cortisol is a glucocorticoid hormone that responds to stress, and it was measured through a laboratory value and at fixed times between 9 a.m. and 11 a.m. The Oxford Happiness Questionnaire measures psychological well-being using a Likert scale, and the Pittsburgh Study Quality Index was subjective measurement containing 7 domains, also using a Likert scale. Lastly, the BDNF, which is a serum brain-derived neurotrophic factor. This is a nerve growth agent, and it measures using a sandwich enzyme-linked immunosorbent assay. So again, this is also a blood lab value. The statistical analysis I had presented in a table from the study above, and what this shows is that there is a modified intention to treat as the original sample size did decrease, reducing the statistical power. An ANOVA was used to assess the within treatment efficacy, and an ANCOVA was used for the between treatment analysis. The absence of reported confidence intervals conclude that it limits the assessment of the precision and the validity of the study overall. So what are the key findings? So the key findings show that the Oxford Happiness Questionnaire did showing significant improvement in attention, memory, executive function of the domains in the ashwagandha group compared to the placebo. The PSS-10, which is the perceived stress scale, also showed a significant reduction compared to the placebo group, as well as the Pittsburgh Study Quality Index. They also showed that sleep quality had increased in terms of improvement compared to that placebo. However, what did not show any statistical significance was those biomarkers, the ones that we do find in our blood lab values, and that was cortisol did not show any significant reduction, as well as that BDNF. So what are the takeaways from this study? So the sample size was very small, and the duration taking a nutraceutical, in my opinion, was very limited as it was only 90 days. The validity of this study, because it was randomized and double-blind, does show moderate to high. However, those confidence intervals were not reported, again, reducing the validity of this study. And the lack of the intention to treat analysis was also not done. The positive part of this study is that ashwagandha root extract may be a safe, natural supplement for adults with mild to moderate stress, which can support cognitive function, stress resilience, and sleep quality. However, the question that I find difficult to answer is that a lot of these markers, like the CANTAB, the PSS-10, they are all subjective. We don't really know, in accordance to a psychologist actually doing these assessments, where these individual stress levels are on a clinical standpoint. Lastly, positive is that ashwagandha is an adaptogenic and neuroprotective property, which aligns with the emerging evidence supporting the use of nutraceuticals in mental wellness. So there is positive, and I'm very, very curious to see down the road if these studies with ashwagandha have more validity in terms of these randomized, controlled, double-blind studies, maybe at a longer duration, and really having a psychologist do these psychological well-being tests on these individuals to really understand significance in the data. Thank you.